Total bed bath is for comatose patient, paralyzed patient, bedridden patient, and any patient who can't move well or cannot move at all. Purpose of total bed bath is for blood circulation, refreshment, personal hygiene, and relaxation. Procedure of total bed bath. Step number 1. Before proceeding to the room of the patient, always check the chart for the patient's profile, room number, any doctor's order, medication, or any important notes that you need to know so that you can prepare the materials that you will be needing. Step number 2. Knock on the door 3 times for courtesy to inform the patient's relatives or any visitor that you are entering the room. Step number 3. Greet the patient cheerfully and inform them about the procedure you're about to do. Step number 4. Turn off any cooling agents and open the windows for circulation. Step number 5. You can now prepare the materials needed. The Kelly's pad, bucket or pail, the dipper, kidney basin, eye mask, ear covers, shampoo, comb, brush, cotton buds, cotton balls, feminine wash, lotion, nail cutter, oral antiseptic, tongue depressors, towels, underpads, towelettes, new set of gown, lip balm, pick up forceps, bed pan, rubber sheet, thermometer, three basin, and lastly, diaper. Step number 6. Before starting with any procedure, make sure to do proper hand washing to eliminate any microorganisms and wear a clean gloves. Step number 7. Get a thermometer to check the temperature of the patient. If the temperature of the patient is 37.5 degrees Celsius and above, do not proceed with a total bed bath. Do a tepid sponge bath instead. Take note and report it to your supervisor. If temperature is normal, you can now proceed in the bed bathing. Step 8. Starting with the face, get a towel and a basin with a clean warm water in a temperature of 38.5 degrees Celsius or 105 to 110 degrees Fahrenheit. Step number 9. Soak the towel in a clean water and proceed in cleaning the eye first, from inner canthus to outer canthus. Do it for at least 3 times, then forehead to nose, small c or cheek to chin, big C or forehead to chin, then do a S pattern, then inverted S, and after the face, clean the nose and ears with the cotton buds. Step number 10. Proceed now in the oral hygiene. Soak padded tongue depressors in the oral antiseptic or Bactitol, and place the kidney basin and towelettes in the neck and side of the face of the patient to prevent the patient gown from getting wet in case of any spillage. Then, open the mouth with the tongue depressor and get the padded tongue depressor and clean the upper and lower palate, tongue, inner cheek, gums, and lips, then do the aftercare. Pat dry and apply the lip balm on the patient. Step 11. Proceed in washing the patient's hair. Place the pillow to the side to give space to the Kelly's pad and put the patient in a diagonal position. Place a towel in her pillow and roll the towel in her nape, the neck to prevent the patient's pillow to get wet, and the bed and gown also from getting wet. Comb the hair of the patient from tip to top and check the scalp condition. Then, put an eye mask to prevent irritation on the shampoo and water, then ear covers to also avoid any water getting inside the ears. Next, pour a small amount of shampoo in your palm and make a lather. Massage the hair with your fingertips to promote blood circulation. Rinse now with clean water and make sure there's a bucket at the bottom of the Kelly's pad to catch the water. Then remove the eye mask air cover, and rolled towel. Cover the head of the patient with a towel, then place the patient back at the original position. Step 12. Prepare a 3-basin containing a warm clean water, soapy water, and clean water again for the final rinse. Then wrap around the towel in your hand and start cleaning in the patient's neck. Expose only the part that is being cleaned. Clean with clean water followed by the soapy water, then clean water for the final rinsing. Then pat dry with a clean towel. Step 13. Proceed in the patient's body, starting with the arms. Put a rubber sheet, then a towel to prevent the bed from getting wet. Start cleaning arms that is away from you and clean it from distal to proximal, down to the axilla to promote blood circulation. And return after cleaning on one arm and proceed on the other arm. With the same process, don't forget to do the aftercare. Then proceed in the patient's hands, soak the hands and clean the interdigital spaces in clean water, followed by soapy water and clean water again for the final rinsing. Don't forget to pat dry, then proceed on the other hand with the same procedure. Before proceeding on the trunk, change water and clean the upper chest. Make sure to clean thoroughly, especially under the breast and the side of the trunk of the patient, since this is where the sweat accumulates more often. Then pat dry, then cover the upper trunk again with the towel and proceeding in the back of the patient. Raise the side rail for patient safety, then place her in a side lying position. Put a rubber sheet, then a towel to prevent the bed from getting wet. Start cleaning the back, now in a lateral or circular motion to promote blood circulation. Don't forget to pat dry. You can also offer the patient a massage. Step 15. You can now proceed in the lower extremities. Start with the leg that is farthest from you. Place a rubber sheet and a towel to prevent bed from getting wet. Clean from the distal to proximal down to the inguinal area to promote blood circulation, and return, then do the aftercare. Pat dry, then proceed on the other leg with the same process. Clean from the distal to proximal down to the inguinal area, then pat dry with a towel. Place a rubber sheet and a towel under patient foot, then soak the towel in clean water to break out any dirt built up, and clean the interdigital spaces and fingers in the soapy water. Lastly, rinse with clean water and pat dry. Step 16. Now, in the last part of cleaning, remove the diaper and scrape off any fecal material with a diaper. Roll the diaper and do the double bagging and dispose it in a yellow contaminated bin. Insert a bedpan together with a rubber sheet. The bedpan will serve as a catch basin if in any case the patient will pee or eliminate while you are cleaning the genitals. In a basin, mix water and feminine wash and put your materials where you can easily reach them. To save time, put cotton balls and pick up forceps. Clean the genitals of the patient. Since our patient is female, do the lateral or parallel stroke or do the 7th stroke. Start cleaning in the symphysis pubis down to the anus, then don't forget to pat dry. Remove the basin and the bedpan. Then place the patient in a lying position again. Step 17. Put the gown above the towel, then start inserting the arms. Afterwards, pull the towel gently from the bottom. and place the patient in a side lying position, then tie and secure the gown of the patient. Then, remove the glove since it's already dirty and throw it in the yellow bin. Place a new set of underpads and make sure to carefully put the patient in a lying position again and remove the used underpads. Then remove the towel and the head of the patient and comb her hair from tip to top. Then apply lotion to the body to prevent the skin from drying. Also cut the nails of the patient if needed. Last but not the least, Step 18. Put the top sheet again and take the temperature of the patient to see if the procedure is successful. Don't forget to do your documentation and aftercare.